Welcome to another episode of Point of Care Ultrasound Education on the POCUS Club channel. Thank you for tuning in. Over this series, I have a special guest joining me in our mission to teach point of care ultrasound to clinicians who look after patients and would like to use the best possible bedside tool to help diagnose and treat their patients. Dr. Peter Weimersheimer is joining us. For these few episodes, Peter has worked as an emergency physician looking after the people of Vermont and has recently joined Butterfly as the Vice President of Clinical Integration. Peter was one of my supervisors on the Ultrasound Leadership Academy Fellowship, and I consider him one of my mentors and a friend. Today, we are going to remotely teach the Royal College of Surgeons of Ireland's Sonogame's team how to do the eFAST exam. We are going to do this entirely remotely. Peter is casting in from the wilds of Vermont, and I am in my kitchen. This will be split into episodes for each of the locations that you will scan in an eFAST exam: the right upper quadrant, the pelvis, the left upper quadrant, and the subxiphoid area. The lung component I have already covered in previous episodes, and you can watch them over here. If you are interested in teaching remotely, observe the language that we use to describe probe movements. This is especially so even if you are teaching at a live course. Maximize the amount of probe time for your learners. I hope that you will be able to use this both to troubleshoot your own images and when teaching your colleagues the eFAST examination. Okay, so left up quadrant if you like.
Yep. Just put a little bit more gel. Alright, put that near your head. Alright, so probe to the table is what I remember about this. Yeah, you're good, yeah. Okay, so...
Okay, good view. Okay, so
Yeah.
what's this structure?
Spleen.
Excellent. And this?
Kidney.
Perfect. So you got a kind of like a bit of the diaphragm up there. Excuse me. There's diaphragm up there, and then there's the spleen, kind of like the angle between the spleen and the kidney.
Yeah, okay.
Where do you think the fluid is going to appear, Katrina?
So I vaguely remember that we were looking for fluid. It's more likely to be between the superior pole of the kidney and the spleen.
Yes. Superior, no. So it's going to appear between the diaphragm and the spleen. So
Yeah.
you're kind of like your key part here on the left upper quadrant exam is to actually look up here.
Oh, so is this the infradiaphragmatic?
Yes, that's correct.
Okay.
Because this space is actually really tight. So the ligament that holds the spleen with the kidney is really, really tight. And you don't get free fluid hanging out in there, you know.
Okay, so I'm looking for... Could you put the line back on for where I'm supposed to look?
So you need to go up here.
Okay, and so is this view that we're having right now, is that sufficient to...
Not really. So you probably need to move the probe up a little bit more. Yeah. Okay, so you can see the lung curtain over here coming in.
Yep.
If you want to bring the probe more posterior, just a tad bit more posterior. Yeah. But at the same time, direct the probe, tilt the probe downwards a little bit. Yeah, exactly. So you need to go posterior and then tilt it forwards.
So is that doing it?
Yeah, so if you just fan it just a little bit, so, you know, like tilt it back and forth a little bit, just so you can see the kidney in this space here. I think that's kidney there, yeah. Okay, so his spleen kind of goes up there and then kind of comes around here. So you can kind of see the diaphragm over there. So you want to see, you want to make sure that there isn't kind of free fluid up there.
Finding that view very difficult. Could I get you to tilt towards me?
No, don't get him to tilt.
No?
No, so literally put your hand into the bed.
Yeah, like I'm at the bed right now and I'm finding.
So if you can see me, you can hold the probe like
Yeah,
this. So have the sorry.
like that.
Oh no, sorry, the other way. So you
Like
have your
this.
exactly, and
Okay.
then your fist more or less is on the or your the back of your finger should be on the bed, and you should be pushing almost into the bed.
Are you okay? Yeah, I know it's putting a lot of pressure.
Yeah, you don't necessarily have to exert a lot of pressure on him. You can exert the pressure on the bed,
Okay.
and then slide the probe up a little bit.
Okay.
Okay, slide up a little bit more. Okay, there you go. You saw the diaphragm there. There was this bright white line. So you can tilt back and forth to try and visualize that. No, there you go. So over there.
Okay. There, I see what you're saying there.
Yeah, so you can see that there. Okay.
Okay.
All right, excellent.
Or
No, you need to slide the probe. So your hand must almost be touching the bed.
oh, like that?
Yeah, but you need to slide the probe back as well. Now that's the tail of that's the tail of the spleen here.
Yeah.
So you need to go more
Up.
superior. Yeah. There you go. So you see spleen here?
Yeah.
Okay. Now, if you tilt the probe tail up a slight bit, you should start to see the kidney over here. There you go.
Oh yeah. Oh,
Okay.
okay.
Right? So if you had the probe like completely tailed down, what you were seeing was bowel, likely stomach.
Yeah.
Okay. But then once you tilt the probe tail up, if you think about it, your anatomy lessons, your kidneys are retroperitoneal, isn't that right?
Yeah.
So that's your kidney and your spleen here.
Mm-hmm.
So where is the fluid going to appear?
Under the diaphragm.
Under the diaphragm first. Yeah, perfect. Excellent. Okay. This space is very tight, so unlikely that that's going to be very positive unless, like somehow or other the spleen is ruptured in that particular area. Okay.
Yeah.
So lots of bowel here still. So if you tilt the probe tail up a little bit, okay, and you need to go more superior in that direction. Oh no, his spleen disappeared.
Yeah.
So remember what I told you, your hand must be almost on the bed itself, right?
Oh, okay. Yeah.
There you go. Okay, so you can start to see the spleen coming in here. Oh, this is lung now. We're doing lung ultrasound. Great. There you go. Okay, spleen.
Yeah.
Now, how do we see the kidney? There you go. That's the kidney there.
Yep.
Okay, excellent. And then you see the spine, and then you clear the same again, above and below. Okay. Happy enough?
Yes. Thank
Good
you.
job, Dilal.
Okay. Watch your
And my bias, I would take your hand and flip it over, and get your fingers on the bottom and the thumb on top from the other side.
Okay, yeah.
No, so see your go from this side.
Fingers on the.
Yep.
Sorry, what do you?
Dots towards here.
I just turned it the wrong way. Oops.
And hold it up. Let's flip upside down. Take your hand and flip it over so it's underneath the other coming from this side over here.
Oh, like this direction.
Yeah.
Okay.
There you go. Because you're gonna because this is a harder image to get. Instead of being at 10 o'clock, you want to be with knuckles in the bed. So you want to be right over here.
Okay.
So slide up to right over. Take your hand and slide up a little bit this way.
Okay.
There you go. And now fan really close to the bed surface itself. So this can be a little more challenging. You have to move around sometimes to find that. There it is. You just had a good view. It's always as soon as you take your eye off the picture, it looks there. So there's spleen, and his kidney is right in here someplace. So just mess around a little bit. You'll get it. Right. So there's spleen. Right. You see that up here? That nice homogeneous tissue.
Mm-hmm.
Maybe a little more shallow. So if your spleen is here, you want to slide a little more up towards the head. So I'd slide just a little more that way. There it
You
comes.
slide.
See that? See that?
Oh, okay. Yeah.
So one thing to remember, and I can't see the entire body here, but there, if you take if your kidney is over here on the right side, the left is going to be more towards the head. So if you do an imaginary line to where you wear, you know you have to slide up to get the spleen over here. So there's beautiful spleen.
Yeah.
And what you want to see on the left side, if you can, to really be sensitive for blood, is to see spleen and diaphragm. So slide up one more rib space. Go this way still. And there you can see there's lung. So you have to mess around to try and see. And this is a little air here, so you probably get more gel. But you want to see if you can just kind of slide and just fan around and see if you can see that little bit of diaphragm between spleen and diaphragm, or that area.
Okay. Let's see if that was enough.
Oh, never have too much. Super, look! Oh my gosh, that was perfect. You just had the most perfect image ever.
Oh, is that?
Oh, that is fantastic. There's your kidney, there's your spleen, and you have a little bit of diaphragm coming over here. So try sliding just a hair north towards the head. One more rib space.
Okay.
And and now you just want to be fanning around and see what you can get. So it's getting obliterated by lung, so you might not get that diaphragm interface. So typically what I'll do here is I'll just literally take the transducer and kind of go this direction on chest, really low, and just kind of just move this way, fanning, and see if I can pick up that diaphragm and spleen. So you're getting a beautiful spleno-renal interface. That's great. And the goal is to see if you can get this diaphragm, just like you said before, on this, over here. Just like you saw before on the right side. And it can be challenging. There it is. Perfect. There's diaphragm. You just had a beautiful view. See if you can get back to that.
I just slid.
right there. That's where you want to anchor your hand, because now you're seeing right here is spleen and diaphragm. That's where you're going to see blood. You're going to see blood here, or you're going to see blood by the paracolic gutter over here. You often do not see blood between the kidney and the spleen. So that's your money shot, is to try and get a little bit of that diaphragm that you had over here and look for blood there. And then you can slide down to paracolic gutter over here.
Or because he's been thrown off a motorbike.
So I
I'm, like,
thought
trying
that
to-
was that right there.
Okay, wait. So that's the. Okay, I'm gonna make sure I'm
Yeah.
looking at the right thing. Okay, so that's definitely the spleen.
Yeah, so that's the inferior pole of the spleen right here. You can see it right there. So you want to get superior. So you have to slide north, slide to the head. Keep going. Keep going. So you want to go this way. It's not too far. There's lung. So now you want to just really fan back and forth and see if you can get rid of the lung and just see that spleen. So typically it's going to be really low towards the bed. Right there. And maybe, so try and slide down one, right around here is where you should be, probably. And this is a challenging shot. You had it before, so it's there, and it's just a matter of just getting used to how to recognize where you need to be. Super. So there's your spleen.
Yeah.
And so right there, beautiful. See that diaphragm right there?
Okay.
That is gorgeous. Right? Just fantastic.
Yeah.
All right. And so as you see it, when he breathes, it ruins the image. So you have to, if you have him on a vent, you can shut the vent off. Right there. That's fantastic. When this lung excursion goes away, there's beautiful view of, there's kidney, spleen, diaphragm. Negative.
Nice.
Yeah,
No blood,
really
Greg.
good. That was really nice.
More shot.
Yes.
So make sure the probe marker is, you need to flip the probe again. So this is your diaphragm. Your diaphragm is appearing on this side. So I think your probe marker, probe marker needs to face towards the patient's head, which is what happened here? Which is in this direction, towards Thomas's head.
Yeah.
Okay.
Got it now, yeah.
What you need to do is you need to bring your hand like almost to the bed. So you need to go quite posterior. Slide the whole probe. Yeah, there you go. So you can see a bit of spleen there when you did that. And then that's the kidney there.
Okay.
That's
I'll take your word for it.
spleen.
Okay.
If you're not convinced, then you need to bring the probe. You need to make sure that there's good contact with skin and the probe. Now, okay. if you slide the probe just very slightly in that direction. So you see how the spleen is appearing here?
Yes.
Okay. Now,
What's the white stuff behind the spleen?
the white stuff here?
Yeah.
So that's probably all the vascular bed, I'd say. So you know, that's like the splenic artery, splenic vein, and all that kind of stuff.
Okay.
But what you can see here, the area that you're particularly interested in is over here and over here. Okay.
Okay.
And if you tilt the probe tail up a small bit, you start to see the kidney.
Oh, kidney.
That's perfect. Exactly.
Yeah.
Okay. If you tilt the probe too far tail down, then because you're insinuating anteriorly, you're going to see stomach.
Right. Okay.
Yeah, and the vessels, which is what you
Yeah.
what you saw earlier on. Yeah, that's perfect. Yeah, that's when you tilt very anterior, and then if you tilt more tail up, then you start to see
Yeah.
this. Perfect. So applying the same principle, do we see the spine going above?
No.
No. What's all this stuff here?
Bowel?
Okay, so this is the diaphragm. So this we say
That would
is
be lung.
thorax. This is abdomen.
Okay. So that's all lung.
So that is, yeah, that should be lung. But essentially what this is a mirror image. So it's the ultrasound fooling itself, or fooling you for that in this instance, because it's thinking that it's projecting this image over here.
Okay.
All right, it's the way that you just have the angle ash for the spleen. Okay, but anyway, regardless, there's no fluid up here.
No.
Where's the fluid going to be if it was in the left upper quadrant in the abdomen? Where would that be?
It would be behind the spleen?
Behind the spleen.
Or between the spleen and the kidney?
No, so it will preferentially be between the spleen and the diaphragm, because this space is actually very loose compared to this space.
Okay.
Okay, so the if there's blood or anything like that, it tends to track in that area as opposed to over here.
Okay.
Okay.
I can say with relative confidence that there is no free fluid between the spleen and diaphragm.
Perfect. Excellent. That's great.